Hi, it's Arrington. I'm delighted to teach you my 10 nutritional secrets for an amazing pregnancy and an easy birth today. At this point, I've had the privilege of helping thousands of women just like you to have amazing pregnancies and wonderful childbirth experiences. It never gets old. This is my life's passion. Anyway, your time's precious and we're going to be covering a lot of good stuff in this video, so go somewhere quiet and grab a pad of paper to take some notes. Since there's going to be a lot of great information coming your way over a very short period of time, and you have a new learning disadvantage called pregnancy hormones, I've tried to simplify this topic and make it as actionable as possible for you. So, unlike other videos you may have seen, we're going to cover 5 important things you need to consume every day while you're pregnant, as well as 5 very important tips for what you should absolutely not eat and why. You may recall I promised you 7 important secrets. Well, I love to over-deliver on my promises. So I'm going to share 10 important secrets with you. But first, let me tell you a little bit about me. I've been a certified pregnancy, childbirth, and breastfeeding instructor for over 10 years. I'm also a certified doula, and I've helped hundreds of mothers deliver healthy babies. I have 4 children, and I had a variety of birth experiences, including a cesarean for breech presentation with my first, a VBAC in the hospital for my second, and a planned home birth for my third. I also have a master's degree in business administration, and I worked in high tech for over 20 years while having children, so I understand the challenges facing working mothers and working mothers to be. Making it easier for other women to have and raise healthy children is my primary motivation for teaching. I started this journey before I even had kids because of my desire to help my coworkers, many of whom were struggling to raise kids with a variety of health and developmental issues, ranging from asthma, diabetes, and severe allergies to ADHD, autism, and childhood leukemia. When I learned that 1 in 5 children suffer from a lifelong quality of life impacting ailment, I decided that I didn't want that to be me. I've been on a mission for the past 12 years, first to be able to have my own healthy children at a very late age. I was 36 for my first and 40 when I delivered my last baby. And then to help other women just like me who want to beat the odds and have healthy children and who don't necessarily have the time or desire to make it their life's research. My mission has been to take a tremendous amount of scientific information and data that's all publicly available and synthesize it down into easy to understand tips and easy to implement strategies that other busy moms can use. Regardless of where you are in your pregnancy, the information I'm going to share is very important because most of what you've learned about nutrition and diet is dead wrong. Everything you eat and don't eat during your pregnancy will affect your baby, either positively or negatively. Eating right for your baby is not something that can be delegated. You have to do your part. Therefore, if you absolutely do not want to change what you eat, then this video will be a waste of your time. Wouldn't it be great if you knew exactly what to eat and what foods you should completely avoid? Wouldn't it be great to know you're going to gain the perfect amount of weight? Not too little, not too much, but you know what to do in order to gain the perfect amount of weight for your body during this pregnancy? Sound interesting?
Then let's get started. But first,
Time for the standard disclaimer. I'm not a doctor, I'm a pregnancy and childbirth educator. All of this is provided for informational purposes only. Unless otherwise noted, the video content is not intended to be a substitute for medical advice, diagnosis, or treatment. You should always seek the advice of a physician, nurse, midwife, or other healthcare professional regarding your individual medical questions and treatments. I will say that what I'm going to tell you has been researched, and you can get the references and links to research information on my website at www.natural-parenting-advice.com. First, let's cover your most obvious question. Why should you care about what you eat while you're pregnant? If you're wondering about this, then you're not alone. I get asked that question a lot in my birthing classes and on my Facebook page. A lot of women don't understand the importance of taking care of themselves while they're pregnant. I want you to know that healthy mommies build healthy babies. So it's really important that you take really good care of yourself while you're pregnant. There's a lot of conflicting information out there about what you should be eating, so my goal is to provide some clarity and simplify this for you. Today, I'm going to share some easy to implement diet and nutrition tips that will help you feel great and that you can start applying now. Sound good? Okay, let's get started. The first thing you need to think about while you're pregnant is getting the right nutrition. This is important because the vitamins and minerals that are in your blood are much more available to make your baby than the vitamins and minerals in the tissues of your body. It takes your body a lot more work to extract calcium from your bones, for example, in order to build your baby's bones. So it's important that you eat a healthy diet while you're pregnant. And there are a couple of key factors when it comes to eating a healthy diet and getting the right nutrition when you're pregnant. First off, you need to eat only organic food, and that's because you want to avoid GMOs of any kind, as well as all the toxins and pesticides and other things that are sprayed on conventional food. This is something that your mom is likely completely unaware of since food was grown on small family farms up until around 20 years ago. Just so you know, nowadays almost all conventional food has genetically modified organisms, and that's really bad for your health. GMOs destroy the delicate bacterial balance in your gut, making it harder for you to digest food properly and causing a host of other negative repercussions. In addition, you don't want genetically modified organisms getting to your baby. There has been very little long-term research conducted to understand the effects of GMOs on a developing fetus. You don't want your baby to be the guinea pig for study results that won't be published for at least 10 years, do you? So look for these kinds of labels on your food and eat organic food as much as possible. Second thing is to make sure you get between 80 and 100 grams of protein a day. This is really important because protein is essential for building all of your baby's tissues. And so you want to make sure you get plenty of protein. And on top of that, it's been proven through Dr. Brewer's research and clinical practice that women that consume 80 to 100 grams of protein per day have a much lower risk of preeclampsia and premature birth. Preeclampsia, a condition marked by having too little blood, usually occurs after the 7th month of pregnancy. Doctors test your urine for it, and it causes significant swelling. Also known as pregnancy toxemia, it's been on the rise for the last 20 years as more women enter the workforce and have high-level, high-pressure jobs. Both stress and diets that don't have adequate protein are known to cause preeclampsia. This is very serious stuff. One of my close girlfriends was the vice president of marketing for a software developer. She was vegetarian and under a terrific amount of stress while she was pregnant. Looking back, she thinks that she was consuming less than 40 grams of protein a day, despite thinking at the time that she was eating a very healthy diet filled with dark green leafy vegetables and complex carbohydrates. She ended up developing hypertension in her 3rd trimester and delivered her daughter 4 weeks early. Even after her daughter was born, Lauren had multiple organs in her body shut down. She almost died and ultimately spent a month in intensive care and received over 200 pints of blood. During that time, her brother's family raised her daughter. She didn't even get to start taking care of her own daughter until she was over 2 months old. She lost all of her hair, she was unable to breastfeed, and it took her a full year to recover. You can see in the picture on the left, that was shortly after she delivered her daughter. And you can see she's very anemic. That's when she was receiving a whole lot of blood transfusions. She was hemorrhaging. And then on the right, her daughter's about a year old then, and she's just starting to grow her hair back. So it was a long recovery for her. Preeclampsia is just a very serious thing. And I'm not telling you this story to scare you. That's not my intention. I'm telling you because this is an easy to prevent condition. What I find unbelievable is that this very common pregnancy-related disorder claims the lives of over 76,000 moms and 500,000 babies every year. Every year. And it's totally unnecessary. I don't want this to be you. So eat your protein. The next thing you need to do is eat a lot of green leafy vegetables. Why? Because the vitamins and minerals in green leafy vegetables are wonderful, and they are just what your body needs to build a healthy baby. You really can't eat too many green leafy veggies while you're pregnant. And the last important thing that you need to make sure you consume every day while you're pregnant is lots of healthy fats. Nowadays, people get really concerned about fats, and they get concerned about fats being unhealthy. So let's talk about that really quickly. Fat from olive oil, coconut oil, cod liver oil, other fish oils, flax oil, and butter is wonderful for you. However, you should avoid all hydrogenated oils. You should also avoid corn and other vegetable oils. You should avoid the vegetable oils because we typically already get too many omega-6 oils in our diet. Instead, you want to emphasize omega-3 oils like fish oil or flaxseed oil. Olive oil is monosaturated and should be consumed cold since high temperatures denature it. Coconut oil, butter, bacon grease, tallow, and lard are all great oils to use when you're cooking. Let me also address another concern that many women have. Fat is not going to make you gain weight. A lot of women get very worried about how much weight they're going to gain while they're pregnant. For many years, you've heard that carbohydrates are good and that fat is bad. The American low-fat, high-carbohydrate diet experiment, I'm calling it that because there was never any actual science behind the low-fat, high-carb recommendations. And this diet experiment has made the American population one of the heaviest populations in the world. Meanwhile, low-carbohydrate diets like the Atkins diet have been proven to be an effective way to lose excess fat. If you're interested in learning more about this, I recommend either of these books by Dr. Mary Ng. She's a nutritionist and biochemist of international renown for her research on the nutritional aspects of fats and oils. I also want to point out that while you should never try to lose weight while you're pregnant, it does goes to show that a low-carb, high-fat diet will not cause you to gain excess weight while you're pregnant. And I'll tell you from experience that if you eat a healthy diet, a diet that has plenty of protein and green veggies and healthy fats, so that you're getting the proper nutrition, and if you cut out all the bad stuff, like processed foods, sugars, starches, and simple carbohydrates, your body will gain the perfect amount of weight for you during this pregnancy. I don't want to geek out nutritionally because my intention is to give you a few simple strategies that you can take action on today. So let me just say that that if you have plenty of protein and plenty of fat in your diet, you're going to minimize blood sugar swings. And minimizing blood sugar swings is important because too much sugar or insulin in your blood can cause a whole lot of other health issues other than just making you gain weight. Things like pregnancy diabetes, which you definitely want to avoid. The last thing I want to talk to you about is cholesterol. Cholesterol causing heart disease is another American myth. We now know that inflammation, not cholesterol, causes heart disease. Meanwhile, cholesterol is very important for your baby's brain development. There's a really good book by Dr. Perlmutter, a renowned neurologist, that details out why brains thrive on fat and cholesterol and how important both are to your baby's brain development. One final thing. Please be sure to drink plenty of fresh spring water during your pregnancy and to salt your food to taste. Both of these are very important to help you maintain your blood volume and prevent preeclampsia. Okay, so now let's talk about what you should eliminate out of your diet while you're pregnant. These are the bad things that will cause you to gain too much weight and do not provide the nutrition necessary for making a healthy baby. Yes, this is tough, but I'm trying to make this as simple as possible for you. First and foremost, you need to eliminate any added sugar out of your diet. And yes, I know that's hard. Sugar is just prevalent in almost everything, from barbecue sauces and ketchups to you name it. They put it in soups, they put it in, they put it in some of the most amazing places nowadays. It's even worse because it's not just sugar you have to watch out for. You really have to watch out for the high fructose corn syrup, which is in almost all processed foods. Confusing the issue further, most processed foods use a variety of names for sugar. Here's a simple tip. If you cut out processed foods, you will also be cutting out the majority of hidden sugar in your diet. In addition to all the other natural forms of sugar like honey, agave, date sugar and maple sugar, you really have to watch out for some of the more natural sounding man made sugars. Probably the worst and most prevalent man made sugar is high fructose corn syrup, which is in almost all processed foods. Confusing the issue further, most processed foods use a variety of names for sugar and sugar like substances, in addition to all of the natural forms of sugar. So here's a simple tip. If you cut out processed food, you will also be cutting out the majority of the hidden sugar in your diet. And yes, I did just tell you that twice because I know you have pregnancy hormones raging through your circulation, and I just really want you to take that point home. So even though there may be times when you're stressed while you're pregnant and you would just love to have a lot of sugary snacks, I really recommend that you avoid it. Sugar actually suppresses your immune system for up to 4 hours after you consume it. That was something I didn't know until a few years ago. And you don't want to get sick while you're pregnant just because you are craving sugar. Also, eating a sugary snack will jerk your blood sugar around, and you don't want to do that because when your blood sugar starts going up and down, you start having trouble with glucose metabolism. And while you're pregnant, that can be a problem anyway because your body's dealing with so much stress already, and you really want to avoid gestational diabetes. Because we're all human, I do want to give you an important tip. If you do eat something sweet, eat it along with a healthy fat or protein, because both the fat and the protein, when consumed in combination with the sugar, will slow down the digestion of the sugar and minimize the negative blood sugar impact. So go for the organic ice cream made with whole food ingredients over the candy bar in the vending machine if it comes to that. Better yet, make some healthy ice cream. I make healthy ice cream for my kids that they just love, and it's easy. All I do is take a blender and blend up 6 egg yolks with a teaspoon of vanilla, a quarter a cup of honey, 2 cups of organic cream, half a cup of whole organic milk, and a bag of frozen whole fruit. So it's about like 1 to 2 cups of fruit, frozen fruit. And I just blast it in the blender, and after it's blended well, I pour it into my $30 freeze the base ice cream maker. The ones that they're not super huge. You just freeze the bottom in your freezer, and then pull it out and kind of assemble it with the motor on top, and pour the mixture in, and voila! 20 minutes later, it's done, and you have wonderful soft serve ice cream. Our favorite flavors are strawberry, which is just with frozen strawberries, mixed berry, mango, and blueberry banana. And with the blueberry banana, I actually do freeze the banana ahead of time because it helps out my $30 freeze the base ice cream maker, which struggles if it has if the mixture's too hot. Anyhow, you should totally try it. Second thing is you need to avoid white foods like refined flours and starches. They actually break down into simple sugars, and so all the same negative health repercussions apply to them as with sugar. Some of these might surprise you too. For example, potatoes and rice are some of the highest GI foods. That and Wonder Bread. They don't actually show white bread up there. But so there you have it. Processed foods you want to avoid because they're chock full of ingredients that you can't pronounce. Now, covered processed foods, I keep mentioning this, and I just want to kind of hit this home again. One of the problems with processed foods is if you see in the top right there, you get a whole bunch of ingredients that you can't pronounce and that are terrifically bad for you, like wheat gluten, high fructose corn syrup, partially hydrogenated soybean oil. Those are all awful for you, and that's in a loaf of bread in this case. The other issue is, and in California, we really understand this now, they don't actually label GMOs, and they don't label things like monosodium glutamate, which is a neurotoxin and which you wouldn't want to eat while you're pregnant. They'll label it as natural flavors. They call it a whole bunch. Hydrogenized yeast protein is another name for it. But there are all these awful ingredients that are very unhealthy for you that make food taste good, that are put into processed foods, and you really just don't have any control over what's in those processed foods, and the labels are not necessarily easy to decipher. And so you really just want to avoid processed food wherever possible. And these chemicals, like I just wanted to, mention this again, these chemicals have not been tested and are not known to be good for you, even when you're not pregnant, much less when you are. And so when you combine them with, the food additives and the other things, it just adds up to a big question mark and a big negative impact on your health and your developing baby's health. The other issue with processed food is it usually has large amounts of sugar and salt in it, as well as all the wrong kinds of fats. And I did mention that you can see up there on the top right, the partially hydrogenated soybean oil. Well, soybean oil is awful because it throws off your estrogen progesterone balances, and you really don't want to mess with your hormonal balances while you're pregnant because that actually goes through to your baby as well and can cause some developmental issues potentially. And the other thing is the hydrogenated oils are highly inflammatory, and they're the worst kind of fats you can eat. So processed foods are a really good thing to avoid while you're pregnant. Just an aside, there's a misconception around that your baby is protected from the things you ingest and the things you're injected with because of the placenta. And unfortunately, most of the recent studies make it clear that the placenta is really no barrier at all. It does do some types of filtration, but it's highly variable. And so, for example, it's hard for anyone to determine how drugs will affect a fetus. And that's because different drugs get absorbed through the placenta and into the baby at different rates. You can see here in this that many viruses can actually pass through, which is another reason why you want to, avoid being sick. But many drug and toxins pass through, including, alcohol and mercury. And mercury is, again, a neurotoxin. And so definitely don't get dental work done or any kind of mercury fillings if you can. Don't get mercury fillings no matter what, anyhow, because it's bad for you as well as it's very bad when you're pregnant. In some cases, you may take a drug that's the right dose. So the issue with drugs, any kind of medication like cold medication, you name it, any drugs that you take, whether they're prescription, over the counter, what have you, that's the right dosage for you. Say you're 150 pounds. Your baby's going to get a dose that's much larger than that for its body weight because its body weight is so much smaller. And, in other cases, the placenta does do some filtration, so the amounts of the drug that will get through to your baby are smaller, but it's highly variable. And so for that reason, it's best that you avoid anything that you wouldn't want to get to your developing baby. A lot of my students, one of the biggest problems and objections they have to this is allergy medicine. Because, allergies can be a real problem when you're pregnant, and you naturally get congested due to mucus buildup. But there are some really great strategies you can use to minimize and eliminate allergies so that you don't have to take naturally, so you don't have to take allergy medication while you're pregnant. So let's talk about artificial sweeteners. They're clearly one of the things you don't want to eat as well. And the biggest reason for that is they're often neurotoxic. Equal, for sure, is, meaning that they can damage your baby's developing brain. And I'd highly recommend that you should avoid any artificial sweeteners with the exception of perhaps stevia or monk fruit. Stevia, especially if it's not been highly refined, is just a green leaf that's sweet that they grind up. And both stevia and monk fruit are known to be safe. They're just, natural plants that just happen to be sweeter than most other things. And they're also known to not make your blood sugar fluctuate. So you can see there's a picture of monk fruit too there. It's kind of like a melon type thing, and it's very sweet. And they've been using monk fruit in China, the Chinese culture, for years, thousands of years. And then, of course, avoid all other artificial sweeteners like Splenda, NutraSweet, Sweet and Low. They're just awful. They cause cancer, they're neurotoxic, and of course, you wouldn't want to be ingesting anything like that when your baby's brain is developing at such a rapid rate. Just so you know, almost all conventional foods include genetically modified organisms. I want to make sure that you know that almost all corn, wheat, and soy grown in the US are genetically modified. Personally, I even shy away from corn, wheat, and soy altogether, even when they're organic, because I'm worried about cross-contamination. The pollen from corn can get over into other fields, even organic fields, and contaminate the organic corn. So unless farmers are growing things with a vast amount of separation or in a bubble, You just don't know. And I just don't want to get any of these genetically modified organisms in my diet at all. So I actually avoid those foods altogether. Not everyone's as crazy as me, though. Suggest that you only eat organic foods from the US. And this is what I do because I don't trust supposedly organic food from either China or Mexico. And the reason is China's water supplies are all completely polluted. And also their government is very corrupt. And so it's hard for me to believe that food from China could be organic. Mexico is also very corrupt. And so you really don't know what you're getting. So personally, I stick with organic foods from the US only, and I also try to get food from farmers markets where I can actually talk to the growers. It's another good way to um, approach. If you can talk to a grower, you find out exactly how they're producing their food. And a lot of local growers that are working on small acreage, they might not be certified organic, but they actually they're not using and spraying pesticides, and they actually are really enriching their soil, so their foods are very healthy for you. So I encourage you to think about farmers markets if you have some nearby. Okay, so I can tell you're probably starting to feel a little bit overwhelmed by all of this. I know I did the first time around. And quite honestly, I've been researching this for, over 12 years now. My intention is to keep these things pretty simple for you. And so let me summarize the key takeaways that you can do to help yourself have a really healthy pregnancy and so you can build the very best, healthiest baby. As we were just discussing, you need to eat clean, meaning avoid sugar, white flour, processed foods, chemically enhanced foods, and artificial ingredients. And here's what you should be eating every day at a minimum. Eat between 80 and 100 grams of protein a day, 5 to 8 servings of green veggies a day, healthy fats with every meal, and you want to salt your food to taste. It's important that you get enough salt, actually. If you're having trouble with swelling, you should actually increase your water and your salt intake. That'll actually help with the swelling. Your body tends to retain water when it's not getting enough water or it doesn't have enough salt to hold on to the water. And you want to drink at least 8-ounce servings of spring water a day. And I suggest spring water because it's not fluoridated. Fluoride is another neurotoxin, and it doesn't have chlorine in it or any other harmful chemicals. So if you get like Calistoga spring water or spring water from a known source, I encourage you to do that. I suggest you eat the above together 3 times a day because they work together synergistically to keep your blood sugar levels consistent and to ensure you absorb the most nutrients possible from your food. For example, putting butter or coconut oil on steamed green veggies along with sea salt will ensure your body can absorb the calcium and other minerals out of the vegetables. Your body actually needs the fat to absorb the minerals, and your baby needs the calcium to build its bones. One last thought to leave you with, and I can't emphasize this strongly enough. If you have a healthy diet that has plenty of protein, green veggies, and healthy fats, like I'm suggesting above, so that you're getting the proper nutrition, and if you cut out all the bad stuff, the processed foods, sugars, starches, and simple carbohydrates, then your body will gain the perfect amount of weight for you during this pregnancy. Your body really has a wisdom about this. And so if you're eating these healthy foods at these serving quantities and you're cutting out the bad stuff, you don't need to worry about weight gain during your pregnancy. And guess what? Women are kind of genetically optimized to gain a certain amount of weight for each pregnancy. From pregnancy to pregnancy, it can change, and from woman to woman, it changes. And so there really aren't any standard charts for this. But if you start restricting calories and you start restricting nutrition, that's really going to be a bad thing for you and your baby. So I really just can't emphasize that enough. Normally, that would be it, but I want to give you something special today. Normally, this is only included in my pregnancy and childbirth classes. By the way, if you found this video to be valuable to you, I would be delighted if you would sign up for my Your Amazing Pregnancy class. In the span of a full lifetime, we only get the privilege of being pregnant for such a short period of time. I want to help you make the most of this special time. So if you're interested, I want you to click on the link below this video or the link at the end of the video. That will take you to a page where you can buy the class and get started today. Back to ending your sugar cravings for good. The technique I'm going to teach you is a neurolinguistics programming technique to end cravings of any sort. Once you get good at it, it can take less than a minute to do. My students love to use this technique anytime they find themselves craving something they shouldn't eat or drink. To start, I want you to picture in your mind your favorite food, the one you love but absolutely should not be eating. I want you to imagine it very clearly, in full color, and I want you to notice how big the image is in your mind. Now, I want you to imagine that all the color is draining from the food. Slowly notice that the color's fading, getting less and less vibrant. Also imagine that it doesn't smell very good. Perhaps it has a chemical smell, or it smells a little rancid, or sickeningly sweet, or it doesn't smell like anything at all. Also imagine how the texture really isn't to your liking. Notice it becoming lumpy, or hard, or mushy. Continue noticing the color draining away until the food is completely black and white and it smells awful, like really bad gas or like nothing at all. Notice how the texture makes you want to gag. And now I want you to imagine that that black and white picture starts getting smaller and smaller as it drifts farther and farther away from you, continuing to get smaller, just fading away in the distance, until poof, it disappears completely. And now I want you to imagine your favorite healthy food, the one you know you should be eating more of. Take a minute and decide on the perfect healthy food that you should be eating right now. And now I want you to imagine it getting bigger and bigger and closer to you. I want you to imagine it getting more and more colorful as it gets bigger. And notice how wonderful it smells. Imagine the perfect taste and texture in your mind. Imagine it being the perfect temperature. So yummy and so good for you. Notice how wonderful it smells and how wonderful it tastes as the picture of it gets bigger and bigger in your mind. And as the picture gets even more colorful and vibrant. Yum. Imagine how good it will feel in your tummy. Imagine how wonderful all of those wonderful vitamins and minerals and other nutrients will feel in your body, nourishing your body and your baby. Now, if you want to stop and eat it right now, then we've done good. If not, keep working at it. Perhaps imagine the perfect healthy food to accompany whatever you're picturing in your mind. And imagine that getting bigger and bigger and more colorful and tasty. Daydream about how wonderful the two will taste together. What we just did here is a very powerful neurolinguistic programming technique that has helped many of my students end food cravings and help them get control over what they are eating and drinking. So I want to encourage you to try it anytime you have a craving for something you know you shouldn't eat. We spent a lot of time talking about nutrition during this video because what you eat while you're pregnant is one of the most important things that will empower you to make a healthy baby. Would you like to learn more? Because I would be delighted to teach you how to have an amazing pregnancy and an easy birth. Are you busy and stressed and worried that you might not be doing all the right things? This is a real concern because pregnancy is not just about building a cute baby, although we love that part. It's also about getting your body ready to give birth. Doing all the right things means that you have a strong bag of waters that doesn't break too early, a strong immune system that fights off infection, a labor that begins when it's meant to begin, which may be after 40 weeks and still be exactly the right time. It means a contraction pattern that doesn't powder out. It means the endurance to go the whole birthing time, something that eating and drinking during labor will help with. It means having the strength to be active during labor and to work with your baby so that he or she can be born with the least possible resistance. It means having strong pushing contractions to expel your baby. It means having minimal bleeding and an abundant milk supply. And it also means having very little or no postpartum depression. Do you feel like your body's been taken over by aliens? Your body's undergoing a tremendous amount of changes to make a healthy baby. Every day brings on something new or something unexpected. With so many changes going on, it's easy to feel overwhelmed. Do you secretly feel guilty because you're having a hard time enjoying your pregnancy because you're so uncomfortable? Are you learning that the advice you get from friends is not only unhelpful, but many times makes you feel worse? Do you sometimes think you'll have to move to another planet just so you don't have to hear another pregnancy nightmare story or about another traumatic birth experience? Have you noticed that your mom's advice expired over 20 years ago? A tremendous amount of things have changed both in the workplace and in our food supply. 20 years ago, there were no genetically modified foods, and fewer women worked in high level, high stress positions in the workplace. You may have had a stay at home mom, even. Also, birth options have changed dramatically over the past 20 years. The birth options available to you are completely different from those that were available when your mom delivered you. Do you feel overwhelmed and helpless to help yourself? I certainly did, and most of my students have felt this way as well. And guess what? Outwardly, I tried to act like I was just fine, 100% confident and excited about being pregnant, while secretly, I wondered just what I gotten myself into. And thanks to pregnancy hormones, this happened every pregnancy, not just the first time. Truly, having the right information at exactly the right time makes a huge difference. Are you secretly terrified about childbirth? As a culture, we women tend to overly dramatize our birth experiences. So not only did I feel like my body had been taken over by aliens, but I was worried I might deliver one. No, seriously, let me tell you a funny story. I almost didn't have kids because my mother told me horror stories about my birth when I was a young girl. It wasn't until as an adult and after asking some probing questions, I realized that most of the pain and drama in my own birth could have been avoided if my mom was aware about the natural birth process and took steps to set herself up for a smooth natural birth experience. Here's the thing. It was really the doctor interventions that caused her labor to stall and caused them to need to take me out with forceps while she lay flat on her back, causing her to tear back into her anus, which caused her to be incontinent to this day. All of this was unnecessary. They gave her pain medication when she didn't even need it. She was already in transition. And without it, she would have delivered me without issue, just like she did with my brother. It was finally understanding all of this that helped me get over the fear. And then I realized something else. If my mom really believed my birth was so bad, she wouldn't have had another child, would she? But she did. She had my brother exactly 2 years after I was born. Anyway, if you're experiencing any of these concerns or fears, you're not alone. And I want to tell you that most of them are completely unnecessary. That's why I've created a special online video course that you can take at your convenience to help you have an amazing pregnancy. Most of what I share with you in this course, I didn't even fully put together until my third pregnancy, and it has helped not only me, but hundreds of my pregnant students. Even better, each module is less than 15 minutes long, so you can squeeze them in whenever you have a free minute. If you watch one first thing in the morning and one last thing at night, you'll quickly learn everything you need to know. I'll show you how to get comfortable right now so that you can enjoy your pregnancy, including tips for dealing with morning sickness, nausea, and other digestive disorders. I'll also explain exactly what your body's working to accomplish so you can actively help it build a healthy baby. Did you know that many of the common repercussions of pregnancy, like hemorrhoids, stretch marks, varicose veins, that many women live with long after pregnancy, are completely avoidable? I'll teach you a slew of tips for not only making yourself more comfortable while you're pregnant, but also to prevent permanent damage to your body. If that sounds good to you, here's what I want you to do next. Either click the link in this post, or click the link in the video, or click the button by this video if you can see one. The button by the video only shows up in certain situations. You'll be taken to a simple registration page where you can get the class right now. If you order now, you'll also get a special bonus video that includes key pregnancy warning signs that you should be aware of and how to prevent them. All of this for only $49. If you're pregnant for 40 weeks, that makes this class less than $1.25 per week of your pregnancy. By the way, did you know that according to historical statistics, a normal pregnancy has always been around 41 and 1/5 weeks long, not 40 weeks? And that number can vary by at least 2 weeks depending on your genes and your stress level, from as little as 39 weeks up to 42 weeks. Anyway, this class has made a huge difference for hundreds of women. I'm 100% confident that it will make a huge difference for you as well. And I want to offer it to you completely risk-free. So give the Your Amazing Pregnancy course a good, honest try. And if you feel like it didn't help you, just let me know and I'll refund your money, no questions asked. I encourage you to start as soon as possible because we cover so much great information. But if you're just hearing about this and you still have at least a week left before your due date, then you should still take the course. If you order now, you'll also get a special bonus video that includes 4 key pregnancy exercises that you need to do every day during your pregnancy to prepare your body for birth. It will only take you 15 minutes or less a day to perform, and they will make your labor and birth faster and easier. I hope you enjoyed watching this as much as I enjoyed making it for you. My passion is helping women just like you to have amazing pregnancies and easy births. I look forward to seeing you in class. So if you like this, go ahead and buy the Your Amazing Pregnancy online video course now. You're going to love the important information and strategies I prepared for you so that you can have an amazing pregnancy. Thanks so much for watching and have a great day.